Welcome to this quick guide on bladder cancer.
This quick guide to bladder cancer will briefly cover the following topics. What is bladder cancer? Diagnosis of bladder cancer. Non-muscle invasive bladder cancer and its treatment. Muscle invasive bladder cancer and its treatment. Follow-up care and resources and support.
Your bladder is a hollow muscle that stores urine until it's passed through the urethra when you urinate. The bladder has 4 layers of tissue. The inside layer is the bladder lining. Next to that is connective tissue. It contains nerves and blood vessels. The third layer is the thick bladder muscle, which squeezes when you urinate, and the outside layer is made up of fatty tissue.
The cells in the bladder, like the cells in other parts of your body, grow and divide regularly. If a normal cell collects too many genetic errors, it can turn into a cancer cell. As the cancer cell grows and divides, it will begin to form a tumor. This can cause bleeding or affect how your bladder functions.
Each year, about 83,000 women and men are diagnosed with bladder cancer, and about 17,000 die from their disease. More men than women get bladder cancer. There are some risk factors for bladder cancer that you cannot control. These include being male, getting older, a family history of bladder cancer, and birth defects in the bladder or urinary tract. Smoking and exposure to chemicals at work or in the environment can also increase your risk of bladder cancer. Bladder irritation can also increase your risk of bladder cancer. Bladder irritation can be caused by kidney and bladder stones, inflammation and infections, long-term catheter use, and having radiation treat another type of cancer.
Some common symptoms of bladder cancer are blood in your urine, pain when you urinate, having to urinate more often, and increased urgency of urination. However, these symptoms can also be signs of bladder problems that aren't cancer. If you have these symptoms, your doctor may suggest a blood test or an imaging test, such as a CT scan or an ultrasound. They may also suggest that you see a urologist.
A urologist may look at your bladder in a procedure called a cystoscopy. Our friends at Cancer Research UK created a great video that explains both what a cystoscopy is and how your doctor can get a biopsy or tissue sample of your bladder tumor.
If you have bladder tumors, your doctor will perform a surgical procedure called a TURBT. This is short for transurethral resection of bladder tumor. A TURBT is the most common way to remove early-stage bladder tumors. Under anesthesia, your urologist will insert a tool called a resectoscope with a small wire loop through your urethra into your bladder. This part is very similar to a cystoscopy. Your urologist will remove any abnormal-looking tissue using the scope's wire loop. A pathologist, a doctor who has special training in identifying cancer, will look at this tissue to learn more about the cancer.
Your treatment will be based on 3 main factors. 1, the type of bladder cancer. 2, the grade of the cancer. And 3, how far the cancer has spread. The type tells you what kind of cells the cancer is made up of. Most bladder cancer is urothelial, or transitional cell cancer. This kind starts in the cells that line the bladder and urethra. Less common types are squamous cell carcinoma and adenocarcinoma. The grade refers to what the cancer cells look like when they're viewed by a pathologist. A low-grade tumor is less likely to come back than a high-grade tumor. Another thing your doctor will base your treatment on is how far the cancer has spread. A big factor is whether the cancer has spread into the bladder muscle. Non-muscle invasive bladder cancer has not spread into the muscle. Muscle invasive bladder cancer has spread into the muscle. These types of bladder cancer are treated differently.
Non-muscle invasive bladder cancer is the most common. It makes up about 3 out of 4 bladder cancer diagnoses. Non-muscle invasive bladder cancer is stage 0 or stage 1. Stage 0 can be further divided into stage 0A, which is also called TA or papillary tumors, and stage 0IS, which is also called cancer in situ, CIS or TIS. Stage 1 or T1 bladder cancer is still non-muscle invasive because the cancer has not spread into the muscle layer of the bladder, just the connective tissue.
There are several ways that urologists treat non-muscle invasive bladder cancer. The following treatment options work to get rid of the cancer in order to preserve the bladder. You will need a TURBT, transurethral resection of bladder tumor surgery, which we described earlier to remove the tumors. You may need a repeat TURBT several weeks after the first one, or later if the cancer returns. You may also need intravesical therapy, a treatment that is put directly into the bladder using a catheter. A type of immunotherapy called BCG, or one of several chemotherapies, are placed in your bladder during intravesical therapy. Your doctor may recommend that you have surgery to remove your bladder, called a cystectomy, if you have a high risk of recurrence, the cancer returning, or you have many recurrences. We will talk more about cystectomy and reconstruction in the next section, which covers treating muscle-invasive bladder cancer.
About 1 out of every 4 bladder cancers are muscle invasive. This means these cancers can spread into the muscle of the bladder and possibly also into other parts of the body. Muscle invasive bladder cancer can be stage 2, stage 3, or stage 4, which is also known as metastatic bladder cancer. At stage 2, also known as T2, the cancer has spread into the bladder muscle. At stage 3, the cancer has spread through the muscle to the bladder's fatty layer and/or to nearby lymph nodes or tissues. Stage 4, or metastatic bladder cancer, has spread to the lining of the walls of the abdomen or pelvis. It may have also spread into other parts of the body.
We'll start out by talking about treatments that include surgery for muscle-invasive bladder cancer. You may learn that the best way to treat your cancer is to have your bladder and nearby tissue removed. This is called a radical cystectomy, or RC. Radical cystectomy is a surgery most often used for patients with stage 2 and stage 3 bladder cancer. You'll want to be sure you find a skilled urologist who performs this surgery regularly. Your urologist will talk to you about the options to reconstruct your urinary tract and redirect your urine. A select group of people with stage 2 or 3 bladder cancer may be able to be treated with trimodal or bladder preservation therapy. Trimodal therapy includes a TURBT surgery, radiation, and chemotherapy. For some patients who have undergone trimodal therapy and the cancer returns, surgery to remove the bladder will be necessary.
Systemic treatments, drugs that travel throughout the body to kill cancer cells, are also used to treat muscle-invasive bladder cancer. Some people with stage 2 and almost all people with stage 3 and stage 4 metastatic bladder cancer will need systemic treatments. Chemotherapy kills cancer cells by killing fast-growing cells. Immunotherapy helps your body's immune system to identify, attack, and kill cancer cells.
All patients with bladder cancer, no matter their stage, should consider clinical trials as a treatment option. A clinical trial is a research study to test new treatments or learn how to use current treatments better. Ask your healthcare team if there is a clinical trial that's right for you. You can learn more about clinical trials on the Cancer Support Community's website at www.cancersupportcommunity.org. clinical trials. You can search through bladder cancer clinical trials on the Bladder Cancer Advocacy Network's website at clinicaltrials.bcan.org.
Your healthcare team may recommend maintenance therapy. The goals of the maintenance therapy are to delay or prevent the cancer from returning or to slow down the cancer's growth. These treatments are given to extend a patient's life. Maintenance therapy may be intravesical BCG, chemotherapy, or immunotherapy. The type will depend on the stage, your previous treatment, and how far the cancer has spread. Your care team will determine how long to continue maintenance therapy based on your risk for the cancer returning or growing. For early stages of bladder cancer, maintenance therapy may be recommended for 1 to 3 years. While on maintenance therapy, your care plan will include health monitoring. Health monitoring is when your healthcare team watches for any changes in your cancer through scans and other tests. If your cancer grows or changes, you may need to stop maintenance therapy. Bladder cancer patients need long-term follow-up. Because most bladder cancer has a high risk of coming back, you will need to follow up with your urologist and/or medical oncologist approximately every 3 months. At these appointments, your care team will monitor for any side effects or late effects of bladder cancer treatment. If you go long periods of time without your cancer returning, follow-up visits can be spaced out to 6 months or a year between visits. These follow-up visits are very important. Check out our other quick guides on metastatic bladder cancer and coping with bladder cancer at www.cancersupportcommunity.org/bladder-cancer.